Hello, Lyndon. Hello, Alyssa. Hold on, let me see. I can't get the microphone to work. Okay, good.
Morning, Dr. Bethel.
Good morning. Can everyone see the screen, the PowerPoint presentation?
I can, yeah.
Yeah, good. And you can hear me good?
Yeah, you're clear.
All right. For some reason, my headset isn't working, so I guess it's the microphone in the, I'll work on getting my headset to work. Hold on a second. Because I think it comes out much clearer if I'm speaking in the headset. Just a minute before we get started. Let me try. Okay, now I'm on the headset, so it should be super clear. All right. So we're expected to be joined, so we have people in Europe that will be joining us. So they're in London 5 hours ahead at noontime, and in Latvia and in Russia 7 and 8 hours. And there's a few people that in the US, Chicago, California, those type of places. So they're, if they get up really early, so we'll see.
Okay.
So I will probably have everyone on mute just so that, so you'll be able to type in your questions in the conversation box, but we can unmute or whatever, but there's a lot of material to cover here. So strap on your seat belts.
Okay.
Okay, it's 7 o'clock. So buenos dias, bonjour, and labdien. This is Dr. Kevin Bethel. I'm the integrative medicine consultant for the Family Wellness Center in Freeport, Bahamas. I'm also the integrative medicine consultant for Amber Life Clinic in Jurmala, Latvia. So we're going to get started. There's a few people just logging on now. This Zoom presentation should be recorded for later. It should be available in a few days. So I'm going to go ahead and get started. So what we're going to be talking about today is COVID-19 treatment strategies as an integrative medicine consultant. I have some very interesting different insights that I think are worth sharing. I'm not going to go over all of the, great details about the history of the coronavirus and stuff. I think most of us have been educated on that to a large degree on news media and through various research of our own. I have no CME disclosures for this presentation. So the first thing that we want to look at in terms of looking at strategies, and as integrative physicians, we talk about strategies. So hand washing and social distancing, yes, okay, we're going to go beyond that now. So we're exposed to the virus. Our immune system has the first chance to try and deal with this virus. So boosting monocytes, macrophage activity, lymphocytes is a strategy that is worth looking at. So strategy one, to boost the immune system, vitamin D. So vitamin D, as most of you are well aware, modulates over 2,000 of our genes. Most importantly, I'm going to focus today, I have a whole other lecture just on vitamin D, but we're going to focus just briefly on the macrophage activating factor, the vitamin D binding protein macrophage activating factor complex. So supplementing with high enough, it's got to be high enough doses of vitamin D in order to stimulate the liver to produce this macrophage activating factor, 10,000 units a day. So 5,000 units is available twice a day, very safe way to get the levels up. How many people, just show of hands, have heard of LL37? So LL37 is this cathelicidin molecule that is a very potent antiviral that's produced in our body, and vitamin D, it stimulates the production of LL37, also known as cathelicidin. So vitamin D is probably the bang for the buck, available. Hey, it's available free in the sun, all right? But where most people are now in lockdown quarantine, and a lot of people don't even have a balcony to go out and get some sun in a lot of places, they're at real risk now being locked away. So vitamin D is vital. To get 10,000 units of vitamin D, you need at least 50% skin exposure to midday sun for 15 minutes. So some studies. So people always want to know, am I just talking air, or let's back this up with some science. I'm not going to give you all of the published studies, but in a lot of the slides you'll see here, I have like 46 PubMed references talking about vitamin D and its macrophage activating factors as an antiviral. 46 published studies. Here are two. You're welcome to snack on these and go to the buffet line on PubMed and eat all you want. So, we've looked at it for HIV infections. We've looked at it for other infections, other viral infections. Some of the research publications to support vitamin D use in viral infections, and specifically looking at this cathelicidin molecule, this LL37 expression. So the conclusion in this study in Cytokine from 2018 was the treatment of asthma patients with vitamin D reduced respiratory infections, and this was related to the increased levels of cathelicidin. Well, we've been telling all of our patients who have asthma, that they're at risk, right? And COPD and stuff like that. So like I said, vitamin D, real easy and safe to get everyone supplementing on that. Vitamin D3 use for viral other infections. There's over 1,000 PubMed publications on that. There's lots of information. Vitamin D receptor, gene polymorphisms, and LL37 in treating Chagas disease, which is not a virus, but again, when you get a viral pneumonia, you often get a secondary infection from other things, bacteria and the like. So again, boosting your immune system, it's, as they say, a no-brainer. And vitamin D is the most important thing, in my opinion. Of course, adding in other vitamins, vitamin A, vitamin C, not going to do any harm with that. That's fine. And if that's all that people have access to, that's fine. All right, here's one from PLOS 1 from 2017. Conclusion, vitamin D and vitamin E levels were associated with less allergic disorders. Vitamin A was linked to antiviral and vitamin D with anti-inflammatory activity. LL37 was linked to T regulatory cell effects. Human cathelicidin is a proven antiviral. 120 PubMed studies on this. Here are three. Here are three to look at. Some of this is new, all right, from 2020 February. Some of them going back last year. Yeah, here's one where LL37 and rhinoviruses, and here's one talking about viral infections in the lungs. Again, you can read the full study, the abstract. Strategy number 2, to inhibit the, let me admit someone here, sorry, some people are still logging on. All right, inhibit the virus access to the cell. So if we can block if we go back to this diagram that I have here, so the virus has these spike proteins on there, and it has to bind to a receptor. It just so happens that the coronaviruses bind to the angiotensin complex. So I've simplified this complex here as angiotensin ACE2, or sometimes AT2. So if we can cap off and inhibit the virus from interacting with this receptor, that's the second line of defense. So inhibit the virus from binding to the cell receptors. So we have angiotensin receptor blockers, and previous outbreaks of coronavirus, patients who were on ARBs and ACEs fared better. You can look up those studies. I'm not going to go over all of those here. That's old news. But there's a problem. Are we going to put normal tensive people on strong medicines, angiotensin receptor blockers, and cause their blood pressure to drop, and potential side effects, other side effects, have it unmonitored, just freely, willy-nilly, letting these prescription medicines? Well, luckily, we have pycnogenol, which is a naturally occurring angiotensin receptor inhibitor, blocker, that does not significantly drop the blood pressure in most people. So it's been used for centuries as a treatment for viral pneumonia in a lot of cultures, the so-called pine needle tea. All right, so let's look at this SARS outbreak. So all the TANs, the angiotensin receptor blockers, and all the PRILs, the angiotensin converting enzyme inhibitors. There's an issue though. Both of them increase the expression of this angiotensin receptor on the cell. So people who are already on these medicines, they better stay on them, because if they come off of them, because there are some doctors out there advocating that patients need to come off of these medicines because they've picked up on the literature, research that increased angiotensin receptors, and the virus binds to these angiotensin receptor, so it's going to make them more vulnerable to the infection. Well, yes, if they stop their medicines, they're going to be left naked. So one thing that these medicines do is what it does is it increases the angiotensin receptors, and then it can increase the receptor binding site. So they need to stay on these. But what about adding pycnogenol to someone who's already on one of these, especially if they've already come down with symptoms of COVID-19? So first of all, let's establish a little bit about pycnogenol as an angiotensin receptor inhibitor. There are 9 publications in PubMed that I could find on that. Here's one of them. Studies indicate that pycnogenol components are highly bioavailable. Number 1, that's great news. All right, angiotensin converting enzyme inhibitor activity. All right, Pycnogenol as an angiotensin receptor inhibitor, another one, French maritime bark extract. Pycnogenol, a herbal medication with diverse clinical properties. This is a great article. It talks about a lot of the different, it's like an overview study. It has an ability to inhibit angiotensin converting enzyme associated with mild hypertensive effects. So they looked at smokers and other things. So again, people who are smoking are at risk for really serious problems with COVID-19. So this is something that we can utilize. Can pycnogenol help pulmonary edema associated with COVID-19, acute respiratory distress syndrome? So here's one from 2006, control of edema in hypertensive subjects treated with calcium antagonists and angiotensin converting enzymes. So I asked if it's possible to take this medicine along with other angiotensin receptor blockers and to help mitigate some of the side effects. And as all of the clinicians know, that the side effect for some of these angiotensin receptor blockers is edema in the feet and pulmonary edema. And one of the side effects is this dry hacking cough. And what are we telling patients? This is one of the symptoms of COVID-19, is this dry hacking cough. So this is why there's a little bit of controversy. You will hear doctors saying, get the patients off of these medicines and all this, off of these type of blood pressure medicines. I'm saying if they're on them, leave them. But we need to add an extra layer of protection and deal with the so-called side effects. Pycnogenols are promising agents for the treatment of viral myocarditis. This one was interesting. So here we have a situation where we have viral myocarditis, where a virus infects the heart muscle. Very dangerous. For those of you who know, I lost my nurse a couple years ago to this situation. So more evidence for pycnogenol. All right. Angiotensin converting enzyme inhibitor activity, the effects on the immune system, and modulating nitrogen monoxide metabolism have been reported. Pycnogenol can help protect from renal failure. So one of the clinical pictures that happens with the patients that get this COVID-19 is, well, when it gets into the lungs and the kidneys and the vascular system, these are the areas that have high amounts of this angiotensin receptor complex. So those organs, once the cytokine storm starts flowing, these are the organs that start to be affected. The lungs, as we're well aware, kidney failure, vascular compromise. So here's a study that shows that that patients that were taking ramipril, we had an increase of 8% diastolic flow and 12% systolic flow compared to just taking ramipril only when they added pycnogenol. So there is some evidence that not only is it safe and it's synergistic, it adds a beneficial effect to taking an ACE inhibitor for those patients that are already on it. Those that aren't on it, well, it's safe to initiate pycnogenol if there's been a confirmed contact or symptom progression. More evidence for pycnogenol to protect renal function. There's another study. The conclusion in this study is that pycnogenol should be further investigated for kidney function, just in general, not just with COVID-19. We're talking about just in general as a way to help protect patients. And in the Bahamas here, we have a very serious problem with renal failure. It's a big issue. Pycnogenol controls edema associated with antihypertensive medications. Again, another study that looks at how it can be combined with other medications and used as an adjunct in hypertensive patients. So I think I've answered the questions that this beautiful tree, the French Pinus pinaster tree, and other relative species. Luckily on the Bahama Islands, we have 4 islands that grow a relative of this tree here. And so we have a natural resource as a potential source for pycnogenol. So let's look a little bit deeper now. So say the virus does bind to this receptor. It then has to send its RNA into the cell. And there's a serine protease enzyme that actually uncouples this angiotensin complex and allows the RNA to come into the cell. Serine protease. So let's look at this angiotensin cascade. Renin converts it to angiotensin 1, angiotensin converting enzyme, mostly in the lungs, converts it into angiotensin 2. That sets off a cascade of things like aldosterone, which drops the potassium, increases the sodium, raises the blood pressure. All right. But what happens clinically when we have a situation where we have high levels of angiotensin and renin? All right. And these can be measured in the blood. So I actually measure this with some of my clients before even starting them on a ACE inhibitor or an angiotensin receptor blocker. Those of my students who are logged on know that I've talked about this before. So in a low angiotensin situation, you have decreased inflammation, decreased vasodilation and vascular permeability. And the angiotensin receptor blockers, what they actually are doing is sort of displacing the serine protease, one of the things they're doing, and keeping this complex together. There we go. That's what we want. When you have high levels of angiotensin converting enzyme, you get the serine, and the serine protease enzyme gets in there, it disassociates this. It's really the angiotensin 2 component that really sets off the inflammatory cascade with elevated blood pressure, increased vascular permeability, pulmonary edema, and acute respiratory distress syndrome, and a whole host of other symptoms. So if we can inhibit this, and then you see how this is sort of dissociated, it allows the RNA to enter the cell. So this is important. Let's look at this. So I put on this slide here some of the things that can be looked at. EGCG from green tea, this Bowman-Burke molecule, and neem. Let's go deeper. Serine protease inhibitors. So serine protease inhibitors, there's almost 2,000 PubMed publications on this and how they interact with SARS and how it depends on this ACE2 expression to get into, clinically. And so, like I say, you can read the background science on this. Like I said, there's a lot of publications on that. So what do we have? So we have things like, oddly enough, we have papaya. Papaya has bioactive compounds that are serine protease inhibitors, all right? So they've looked at it with dengue virus. And in case any of you haven't heard, this virus is a very strange situation. It is a combination of coronavirus, similar to the SARS outbreak from 2002, but it has components of HIV and components of dengue genetic material in there and protein expressions. How this has happened, I leave that up to your imagination. All right. Serine protease inhibitors. Another one, Camellia sinensis, one of my favorites. For those of you who know me, they know that I did my my defense for my fellowship in anti-aging and regenerative medicine on the medical uses of green tea. So there are 73 PubMed publications on green tea extract, specifically epigallocatechinic gallic acid, or EGCG for short. Specifically with that, there are a whole group of these catechins that are found in green tea and other plants that are protease inhibitors. So green tea. Oh, how did the papaya one get in the wrong space? Sorry about that. That papaya one was supposed to be after the other. All right. So serine protease inhibitors with green tea. Another published study here that's I thought was very interesting. So peanut skin, this Bowman-Burke catechin, 618 PubMed studies on this Bowman-Burke molecule found in peanut skins, all right? And it is a particularly good protease inhibitor. As a matter of fact, it is the Bowman-Burke serine protease inhibitor that is used in laboratory models when they're actually trying to figure out the stuff that was on that previously hand-drawn diagram about how these angiotensin receptors work. So this is the actual thing. right? This is the thing, right? So, wow, I got some of these slides mixed up. I apologize. So this is the one with the peanut skin. Peanut skin is the skin on the peanut, the skin, right? That's where you find this enzyme. Won't hurt to eat the peanut, but the skin that most people throw away, that's where the serine protease inhibitor is. I'll go back and I'll show you the picture of green tea, which should have been up in the other section. So I had green tea growing in my yard, obviously, until this Hurricane Dorian took a lot of that away from us. Blue-green algae is rich in serine protease inhibitors. All right, so I'm not going to spend a lot of time on that, but there are blue-green algae. This is the particular one, Hoffmanni, that has been most studied. But what about other blue-green algae that are edible? Some blue-green algae are toxic, right? So I'm not telling anyone to go out there and eat blue-green algae or anything like that, but there are some that are available, chlorella and spirulina, that are food sources. Neem. Okay, so the Bahamas has one of the world's largest organic neem production facilities. It was damaged a little bit by Hurricane Dorian, and I say a little bit tongue-in-cheek, but no, they're back up and running. So we have a supply of neem in all of its wonderful forms, and the particular molecule that's active is this camphorol 3O-rutinoside that's found in the neem. That is, and here's an interesting study. I like this one because there are other studies, but I like this one. And look at when this just came out, March the 9th, 2020, just in time. They compared neem extract to other epicatechins and other serine protease inhibitors and basically a placebo quercetin. And the results showed that the potential for this neem extract to be developed, against dengue. In this case, they were looking at dengue, okay, as a viral model. But the information applies to COVID-19, all right? And again, this is safe. This is, you can take it as a tea if you don't have access to getting one of the refined extracts of the concentrated oil, and you want to get it from an organic source so there's no pesticides concentrated in there and all of that. I'm not going to keep repeating that. Here's a picture of our neem trees. I have one growing in my yard. There's the fruit and the leaves. It tastes like curry, actually. Very interesting if you use it in your cooking. All right, so it's okay to use it. So there's just another summary slide about the serine protease inhibitors. I didn't put papaya on there, but that's easily available. So we have a lot of things so-called in our backyard or in our pantry that we can use to inhibit this virus. Strategy number 4, inhibit the RNA polymerase, the so-called viral replicase enzyme. So when this RNA gets into the cell, there's a replicase, here I said duplicase, but it's actually a replicase polymerase. But anyway, it duplicates the RNA, replicates the RNA from the 3' end. And just like a massive machine of virus producing, molecules, it's just something that if we can inhibit this, again, as a 4th line of defense, all right? So lo and behold, I already have it on the slide. Look at that, zinc. Zinc is a proven inhibitor of RNA polymerase. So let's look at that. 660 PubMed publications about zinc as an antiviral in general. All right, as an antiviral. Here are 2 of them. What about specifically looking at zinc as an RNA polymerase inhibitor? 25 of those studies are specifically looking at that. Here's 3 of them. Some of them are looking at Zika, one of those, was it flavinoviruses related to dengue and stuff. They're also RNA viruses. And like I say, somehow this COVID-19 has components of dengue in there. So zinc, yes, zinc. All right, so there are food sources for zinc, nuts and seeds, and things like fish and things like that. But really, I sent out messages weeks ago telling people, especially other healthcare practitioners, to please start protecting yourself with vitamin D and zinc. Gather up pycnogenol and and a few other things that I mentioned in there, green tea and stuff, to stock up on them for yourself, your staff, and your patients, especially the ones that get sick. Now that we have mandatory 24-hour curfew imposed, and as of right now, 9 o'clock this morning here in the Bahamas, we're under 24-hour lockdown. All right, there is still commercial flights able to come in. Getting this stuff can be difficult. I have shipments, large shipments on the way, but a lot of what I have is sold out. But I do have my staff protected with this. We're not finished. Let me get on with this. Zinc is a potent inhibitor of RNA polymerase. This is another one. So this one, they actually put an important statement. So beyond the conclusion, they talk about the clinical importance of this study. So when the editors allow something like that, that's sort of like, wait, this is not only, this is important. This needs to get out there. All right. This, really needs to get out there. And this was from 2017. So hopefully everyone on this talk has already, known about zinc as a polymerase inhibitor. So November 2010, zinc inhibits coronavirus. It is it inhibits it through its RNA polymerase activity. Zinc ionophores block the replication of these viruses in cell cultures. Zinc ionophores. Let's look at that a little deeper. That is strategy number 5. So if we add a zinc ionophore to increase the concentration of zinc into infected cells. So there's 484 PubMed references about using zinc ionophores in this method. It's a lot of information. So let's go back. Those of you students and the like who have visited my clinic, you see this poster, which is an original. You can actually see the crease lines in here that I picked up in France. And this is a poster from the pandemic flu 1918 in France, urging everyone to take quinine, or quinine as we say in English. Okay, so this is how to take your quinine. So this person here, he didn't take his quinine well, meaning he didn't take it, and he's on death's door. This gentleman took his quinine, and he's not only so fit, he's ready to get back to the war if he needs to. All right. So quinine from the chinchilla plant, here's some pictures of the chinchilla plant, is a source of tonic water. Wait, we have that in the grocery stores, don't we? Tonic water. Quinine is also available as a prescription and an over-the-counter medicine in a lot of countries, including the Bahamas. But tonic water in the quinine plant contains these 3 quinines. All right, and they're isomers, so technically it's 6. I know someone will call me out on that. So it's technically 6 different quinines that are in this plant. So let's look at them. So the chinchillin is a zinc ionophore. Chemistry 2012 talks about its role as a zinc ionophore. And it also interestingly talks about its with aluminum. It's an interesting article there. Because it exchanges zinc for aluminum. So you get rid of 2 problems at once. Get the aluminum out of the cell and get the zinc into the cell. Aluminum has some potential toxic effects. All right, chloroquine is a zinc ionophore. Plus 1. All right, so chloroquine is a zinc ionophore, a property that may contribute to chloroquine's anti-cancer activity. So those of you also know my role as an integrative medicine consultant. It's also very heavily involved in anti-cancer treatment. So this allows me to have what we call intersectional thinking, because a lot of people have been messaging me saying, well, I don't see the studies on this as an antiviral. And I'm like, well, wait a minute. Yeah, it's, and zinc is an ionophore. So what's not happening is that people are looking at hydroxychloroquine and chloroquine, and they're looking for references of it as an antiviral. It is not an antiviral. Although it is, even in papers published, they talk about antiviral effects, but the way, the mechanism that it's working is because it is a zinc ionophore, allowing zinc to get into the cell and zinc to inhibit the virus replication and duplication. Hydroxychloroquine, also known as Plaquenil, is a zinc ionophore. Okay, here's a study where they looked at it against the Zika virus from 2018. Hydroxychloroquine, there's 120 PubMed studies talking about its role as an antiviral. Not all of them talk about it specifically as a zinc ionophore, but a lot of them, the researchers may have not even understood that it was actually a zinc ionophore, ionophore. So, but anyway, this is what I believe is the mechanism. Here is it looking at chikungunya, Epstein-Barr virus, and hepatitis C virus. What about other canine-related medicines? Has anyone heard of this cleoquinol? Cleoquinol? Cleoquinol is an antifungal drug, antiprotozoal. It has neurotoxic effects in large doses, as does most quinines, including Plaquenil. It is a member of the family of drugs called hydroxyquinolines, right? And it inhibits certain enzymes related to RNA replication. The drugs have been found to have activity against both viral and protozoal infections. So let's look at some of the studies here. Zinc ionophore, cleoquinol. That one's from 2015. Yes, cleoquinol is a zinc ionophore. Here are some studies. I put a little bit more detail. We previously reported that cleoquinol as a zinc ionophore. Our research showed that cleoquinol combined with zinc markedly, I should put that in big bold letters, markedly increased the radiosensitivity. In this case, they weren't looking at viruses, but they were looking at cancer, all right? But the principle still applies, all right? So this is sort of a radiosensitizer. And those of you who will know a little bit about the clinical uses of cleoquinol for treating things like psoriasis and other things like that, but also skin cancers as a photoactivator and photodynamic therapy. For my team in Latvia, this is, we can talk more about this. All right, sea sponges, we have them in the Bahamas, all right? So this namandine A is also a zinc ionophore, all right? So a lot of times in research, they don't want to use the natural product. The scientists want to tweak it just a little bit to come up with a molecule that's just different enough that they can patent it and come out with a medication and make themselves a couple $2 billion. All right. But here's a recent study, again, looking at zinc ionophores, and then comparing it with a synthetic version of it, a mimic as they call it. So here's that sea sponge. All right. We have this natural resource in the Bahamas. I am not advocating that people go and eat sea sponges. Please don't even think that. But what I'm saying is that we're fortunate that we have some natural resources here to help combat this and other similar viruses. So the natural resources in the Bahamas are coming a long way here. So let's go to strategy number 6. And this is probably the most diabolical component that's just been revealed about this virus. Here's an illustration of the virus. So these spike proteins, these S proteins, there are other proteins that I have yet to elucidate, and scientists have yet to elucidate how these have been manipulated and what these components are and how their effects on our health are. But the S protein has been looked at. This is the docking protein, but in the S protein, the COVID-19, specifically spike protein, contains furin, right? There are 37 PubMed publications attaining to this. All right. Here's one just from a couple days, you know, it's actually, this is a pre-release. Some of this information is so important that it's actually being pre-released. So the spike protein in the new coronavirus contains furin-like cleavage sites. Unique protease cleavage site, you know, on the protein, and the novel pneumonia coronavirus, potentially related to viral transmittability. All right, so what is furin? Furin is a pro-protein convertase. All right, there are over 1,500, almost 1,600 PubMed publications talking about furin and what it does in the cell. Here are two that are talking about furin as a facilitating viral cell entry, and the structure and of the glycoprotein for SARS back in 2002. So why should we be concerned about furin clinically? So if this virus has this protein on there, and then we get viruses shed, and then there's the dead virus furin protein floating around in our body, what does furin do? Furin is a cardiovascular disease promoter. Furin is a neoplasm, cancer cell promoter. Furin is a neurotoxin. Furin is a hormone modulator. Could we have asked for something more diabolical? Furin, let's look at them individually. So furin as a cardiovascular disease promoter. And I think we have some cardiologists on the talk and cardiovascular surgeons. 111 PubMed publications on this. All right, here are 4 of them. All right, vascular remodeling. All right, it influences the monocytes and macrophages to invade into the endothelium of the vascular system and convert into foam cells, and promotes endovascular disease. And that affects not just the heart, the vascular system all over the place, and initially vascular permeability. So in addition to the other effects with the angiotensin, this is like adding gasoline onto the fire. All right. So what we have to, we don't want to let it get to this point. We have to inhibit this process. We have to find something to stop this. Let's go on. So the COVID-19 spike furin may cause congenital heart defects. Oh, this was an interesting one. All right. So back looking at the Zika and wondering why Zika was causing the microencephaly. Oh, well, no, that's in another study. But no, this study is looking at something different. Sorry, I got them mixed up. But this one is looking at its essential role in the developmental of heart function. So if we start messing, and so pregnant women who contract this virus, we may start seeing cardiovascular defects, congenital heart defects in the births of women that are pregnant who contract this while they're pregnant. This is really serious, guys. Furin is a neoplasm cancer cell promoter. 500 PubMed studies on this. All right, some of them have just come out that I found interesting. Furin is a pro-oncolytic driver for the KRAS and the BRAF driven colorectal cells. Here's one for ovarian cancer, and here's one for infectious disease. I guess, I don't know, I put that in there maybe by mistake, but there are 500 studies talking about it as a cancer cell neoplasm promoter in various different mechanisms. You're welcome to look them up. Furin is a neurotoxin. So 35 PubMed studies on this. So furin inhibits, so a furin inhibitor protects against neuronal cell death induced by activated NMDA receptors. All right, so wait a minute, furin inhibitor. There is such a thing as a furin inhibitor? Thank God. All right, let's move on. Furin as a hormone modulator. So pro-protein convertase furin regulates osteocalcin and bone endocrine function. All right, this is a study. There are 17 PubMed publications, but I just condensed it down here. So basically, furin decreases the osteocalcin production from osteoblasts, which are related to our white blood cells, right? So they decreased osteocalcin, and this causes a decrease in glucose tolerance, decreases energy production in the cells, and decreases appetite. These are symptoms that are reported with COVID-19. And long-term, after so-called quote-unquote recovery from the COVID-19, diabetes and long-lasting fatigue, appetite and cachexia, decrease. So this is really serious, because this furin protein enzyme that's in the spike protein, if this virus is not completely cleared, could have long-lasting health effects. So could we detect this furin protein? Could we actually develop a test? Oh, wait, it's already been done. And this was done in China, by the way. I eliminated the authors and stuff here, but this is in hypertensive research from November of 2019. Serum furin as a biomarker for high blood pressure. Findings from a longitudinal study in Chinese adults. So the Chinese have already developed a study for this, to measure this, because we may think the virus is cleared, but what about the residual leftover levels of this furin that are circulating, causing long-lasting damage to our body? Maybe we better start looking at this. So in summary, what do we have? What we've seen with COVID-19 and how it relates to furin. Let me see. Where's the? Should be a. There we go. The presence of furins on all cell surfaces allow a dramatically increased ability to fuse with host cells. So this actually gives, even if you are somehow able to block the ACE2 interaction completely, it gives a backdoor mechanism for the virus to still enter the cells through this furin cleaving protein. Diabolical. The furin cleavage allows efficient virus entry into basically all cell types. Wow, the hair just raised on my back. Making COVID-19 easily transmissible at rates up to 1,000 times greater than the virulent SARS coronavirus. Furin-like cleavage in human coronaviruses have been associated with the development of neurological diseases. The presence of furin enzymes on all cell surfaces cleaves and activates the SARS-CoV-2 in a wide range of tissues and organs. It activates the SARS-CoV-2, then unleashes inflammasomes, initiating a flurry of immune reactions that can result in a deadly cytokine storm. This is what we really want to prevent. All right. So what are we going to do to stop this furin? What inhibitors of furin do we have? Alpha lipoic acid and this molecule called calpeptin. So alpha lipoic acid, my shelves are stocked full. Evidence for alpha lipoic acid as a furin inhibitor. Okay, so let's see. Decreases, again, sometimes you have to cross-intersectionally use research from other areas in cancer, because I'm reading cancer research all the time. This was just like, oh, well, when I read about the furin, I was like, I got it covered. So the conclusion is that we can use alpha lipoic acid as a way to inhibit and downregulate the furin molecule. There aren't massive amounts of research on this, but there is that the lipoic acid induced oxidative stress decreases the furin axis in breast cancer cells. So this furin, like I said, I already mentioned that it's a cancer promoter, but so there are studies that are looking at it in the cancer world that we now have to apply to the virus world. Evidence for calpeptin as a furin inhibitor. I'll come back to this calpeptin a little bit, where we might find this naturally. Furin inhibitor proteins against neuronal cell death induced by NMD receptors. So this is an expansion of a study that I'd mentioned earlier. All right, and it talks about how it exactly how it works. So you can read more of that. There are also some chemicals that are used in the laboratory and experimental models for furin, but are they clinically safe? I mean, they have these really long names that I'm not even going to try and produce. They are a ketone, a chloromethyl ketone. And I've done a lot of research with ketones, so I'm looking into this a little deeper, question mark about those and whether they're clinically safe. But they have shown clinical effectiveness against these falvinoviruses like Zika, dengue, and Japanese encephalitis virus. So the pulmonary fibrosis that has been talked about in patients, even patients who have mild to no disease, are having documented decreased pulmonary function after their infection, up to 30%. So this is data coming out of China. That's not what this slide that the study that I'm pointing, that's on the screen is talking about, by the way, but I'm just saying you can look up those reports. A lot of them are like news reports and stuff. I wasn't able to find the actual study, but I did find newspaper reports and stuff, so I didn't want to put that in here, leave it as a question. But those of you who are already dealing with patients that are sick with this, you know that when you listen to the patient's lungs, it sounds like broken glass. It's a very distinctive type of crackling, fibrotic sort of pneumonia that progresses and develops. And, you know, from other reports in other countries that are much more further along, thank God in the Bahamas, we have 0 deaths and very few active cases. Our geography may be protecting us to some degree because we are isolated islands. Something that in COVID-19 is doing this though, rhabdomyolysis. So those of you in the Grand Bahama Medical Dental Association will know that I sent out a memo about 3 to 4 weeks ago asking if anyone had noticed. I had 2 patients with unexplained rhabdomyolysis after having a viral infection, and we're trying to find the cause for it, but luckily those patients both survived, but it was a very bad rhabdomyolysis, and it makes me wonder. So in summary, vitamin D is a first-line defense, angiotensin blockers, getting zinc into the diet, and finding a zinc ionophore. And then on this also, we got to reserve these hydroxychloroquine for patients that are actually sick. We have a limited supply, and now that shipping and supply is very limited, we've got to protect ourselves as healthcare workers, because we are going to be exposed to this virus as healthcare workers. I've just armed you with things that you should have initiated weeks ago, for those of you that are in my group, and continue to initiate. And as things evolve, there will be further things. I may call for another potential meeting, because there are a few other things that aren't included in this presentation that I am working on and other members of my team are working on. So I want to thank you for joining the presentation. Here's my WhatsApp and my email. So if you have any questions anywhere along the way, I didn't go into dosing too much, but I will mention about the pycnogenol. Just a second here. So pycnogenol, the French maritime so the pure extract is like 300 milligrams, but the actual active ingredient of pycnogenol in there is usually only something like 25 to 30 to 50 at the most milligrams of pycnogenol, like 3 times a day. But you know, the 300 milligrams of the basic extract is, and then they have it standardized, you know, listed the actual milligrams of pycnogenol. And those of you who know, as an integrative physician, I like to put the whole team of players on the playing field and not just the quarterback. In other words, I believe, and evidence shows, that while pycnogenol may be looked at, just using this as one example, by the way, maybe, pycnogenol as a molecule may be looked at in, laboratory science and to understand the mechanism. In nature, it works as the whole team. There are other bioflavonoids and other tannin-related molecules that are related to pycnogenol that work together as a team. So my preference is to give the whole team. So there was a little bit of confusion for some people that are in my chat group and stuff about dosing of pycnogenol versus the French maritime bark extract. But like I said, if you can even find this now, I mean, like I said, it's just flown off the shelves, Amazon, so zinc, it's like a month waiting, just to even get your order for zinc, even if you can get it now with Amazon and the like shutting down. But I did send out messages to the pharmacies here on my island of Grand Bahama to please order as much as you can of these things: vitamin D, zinc, quinine, hydroxychloroquine or Plaquenil, because we're going to need it. So, but we have to be rational about how we use it and when we initiate it. I'd be happy to answer questions for anyone who is facing any dilemmas with themselves, their staff, or their clients. So I can take it off of mute if we want, or there should be some chat boxes for people that have had questions. Let's see the chat. Let's see. No questions. Does anyone have any questions before I log off and start seeing patients? All right. Let's go to manage participants, and I'll start taking people off of mute in case anyone has any. Okay, here's some rumbling in the background as I unmute people. But I guess there's no questions. I guess we'll just sign off.
Kevin, this is Dave Munshank.
Hello, Dr. Munshank.
What about breathing issues?
Yes, okay. I have a white paper that I'm preparing that covers more than just what's in this presentation that I plan to submit to a journal. But there are breathing techniques. Those of you that are on my team at Amber Life Clinic in Latvia know that I've talked about this autobaric breathing. So autohyperbaric breathing is a way to expel the pulmonary edema, because there is going to be a situation, and all of us who are listening, where the system gets overrun. No more ventilators. So how can we manage patients and give them something so we can actually basically create hyperbaric chambers within our chest and there's a breathing technique to push the fluids out of the lungs. Part of it is also to lay on your stomach, obviously to let gravity help with that as much as you can, lay on your stomach. And if you have access to oxygen, use the oxygen, et cetera, et cetera, et cetera. Of course, if you have access to a ventilator, of course, that may be needed too. But on an island where I live, where we have basically a tent for a hospital after Hurricane Dorian and an undisclosed number of ventilators that will potentially be available, and the situation of how those ventilators will be used also not fully disclosed. I do not work in the public hospital system. I am a private doctor and private researcher, as I stated in the beginning of the presentation. But there are some breathing techniques I will be putting out. Maybe we'll be doing another webinar talking about that, especially as I get more clinical experience myself with my clients and stuff with dealing with this virus. There are some other things too that are interesting that I'm working on that are not quite ready for prime time yet. So I'd be happy to share the autobaric breathing technique. It's basically a whole other lecture and needs some demonstration and stuff. But I just would let you know that there is a technique to help patients. Rather than just letting them sit there gasping for air, we can help them. All right, I thank everyone. It's time to start a clinic. So we will be signing off.